Hello, good afternoon, everyone, and thank you for joining us here for today's event. My name is Alex McCracken. I'm the Director of Communications and Legislative Affairs for the Department of Vermont Health Access.
And hi, my name is Zach Goss. I am the Director of Customer Communication, also with the Department of Vermont Health Access, which is the host department of Vermont Health Connect.
Thank you, Zach. And today we're here to share some important updates about this year's open enrollment period for qualified health plans through Vermont Health Connect. So just a quick overview of what we'll be doing today. We'll be doing a high-level overview of how open enrollment works, some important things to know for this year's open enrollment, and then we'll have some time at the end for Q&A. Just so everybody's aware, this meeting is being recorded. This recording and all paper and electronic copies of materials presented or shared on screen will be subject to Vermont's Public Records Act. That's 1 VSA subsection 315 at SEC and will be made available to the general public upon request. Participants are responsible for ensuring that no confidential or proprietary information is presented or discussed in the meeting and associated materials. And just so everyone's aware, this town hall does not have an interactive audio between the attendees and the presenters, but we do have a Q&A box. So please feel free to place questions into the Q&A box and we will address them afterwards during the Q&A portion. So let's get started. What is open enrollment? Zach, do you think you could give us a little overview?
Sure. So just at a high level, open enrollment is really, it's a special time of year when you're allowed to, or one is allowed to sign up for and make changes to their qualified health plan. And right now, today, we're talking about open enrollment through Vermont Health Connect or Vermont's healthcare marketplace for qualified health plans. So I just want to level set with everybody. We're talking about the qualified health plans through Vermont Health Connect. These are not the Medicare plans that also are going through open enrollment. So this is qualified health plans, non-Medicare plans. Open enrollment for Vermont Health Connect goes from November 1st to January 15th. You'll want to pay attention to some important deadlines that come up because to get a January 1st start date, you'll have to take action before the end of open enrollment.
Thank you, Zach. So what's changing this year?
Yeah, so here are some big takeaways for what's changing this year. The big picture is that there is more financial help available for those who are eligible to get financial help through Vermont Health Connect. That means when you apply through Vermont Health Connect, you'll be able to see how much financial help is available, and there's more of it this year. Another big change is that there is no more silver cost share reduction, that's CSR, 73 and 77 plans. And if you don't know what those numbers mean, that's okay. Customers who were in those plans in 2024 are actually going to be moved automatically to gold. And the reason this is happening is because most Vermonters are, like I mentioned before, are able to get more financial help in 2025. And there was a change made to the calculation for how subsidies were calculated. So this makes those 73 and 77 plans no longer a good value. So what we also see is that gold plans now have lower premiums than silver plans. And we'll talk more about this later on in the presentation. Another big change is that individuals who are 30, so aging off of a catastrophic plan, will be moved automatically to a bronze plan. The final thing is the deferred action for childhood arrivals changes. This is also known as DACA. So historically, this is a group that has not been eligible for federally funded healthcare, and that's where a lot of the financial help comes from, the federal government. Effective November 1st this year, DACA recipients will be considered lawfully present under the rules for the purpose of qualified health plan eligibility. So this change will make the DACA population eligible to enroll in qualified health plans during this open enrollment. This population will be eligible for subsidies towards qualified health plans as long as they satisfy the eligibility requirements to do so. They can get coverage beginning as early as December 1st 2024 if they enroll in a plan before November 15th, which is just this Friday. So those are the main changes that we're going to see in open enrollment this year.
That's really exciting, Zach. So we're going to have a lot more opportunities for Vermonters to save money on their health coverage for 2025. Can you explain a little bit about the changes to silver and gold plans?
Sure. So this is going a little bit more into detail of what I touched on in the last slide. In 2024 and in years prior to that, you saw a kind of linear relationship between bronze, silver, gold, and platinum plans. That means that bronze were generally had the lowest premiums. So you can see that indicated with the dollar sign, $1 sign. And in those bronze plans, the customer would pay the lowest premiums, and premium is that monthly expense, that monthly cost, regardless of whether you use the insurance or not. And you would be paying 40% while your insurance company would be paying 60% of your healthcare costs. Now, if you had a silver plan, you would have a slightly higher premium. You would be paying 30%, and the insurance would be paying 70%. Gold plans, similarly, keeps going up, higher premium, but your insurance company pays a higher percentage, 80%. Platinum, you pay 10%. The insurance company pays 90%, and those have the highest premiums. So you can kind of see bronze, silver, gold, platinum was the kind of logic that this followed. The more precious the metal, the higher the monthly premium, and the less you pay out of pocket. What's changing this year in 2025, like we mentioned before, is that gold and silver are kind of switching positions. So it used to be that many customers found silver to be a good option for them. And in part, that was because the premiums could be relatively low and they only had to pay 30%. What's changing this year is that gold plans are actually less expensive in premium costs than silver plans, and you still pay only 20% of the healthcare costs. So a silver plan, you'll see, has actually higher premium costs, and you pay a greater percentage of the healthcare costs. So that is a big change to how things are calculated, that it will be really important for Vermonters to consider when they are browsing and selecting their plans for 2025.
So Zach, how do I know what plan I can get and how much it's going to cost?
That's a great question. And before we answer that question fully, I do want to go back to this 1 minute and just remind people that this is only for the Vermont Health Connect plans through the exchange. If you are going directly to your health insurance carrier, the logic might be slightly different. So this change only applies to the plans that you're purchasing through Vermont Health Connect. So back to your other question, Alex, how do I know what plan I can get and how much it will cost? So all eligible Vermonters can choose between the 22 plans that are offered, and how much you pay for the plan really depends significantly on your household size and the income of your household.
And so how does that work exactly, Zach?
Right. So there's financial help available from the federal and state government, and that actually lowers the cost of that total premium. So most of this financial help comes in the form of tax credits. So if your premium is, let's say, $1,000, you may get a tax credit to greatly reduce the amount that you have to pay.
So what else do I need to understand before going further and signing up through Vermont Health Connect?
So I think there's four terms that are important for you to understand when you're choosing your health insurance plan and understanding how much it'll cost. And we have a complete glossary on our Vermont Health Connect info site. that you can go into much more detail about different term definitions, et cetera. But there's 4 terms that I want to call out just to kind of make sure everyone's on the same page about what we're talking about. So those terms are first premiums. So premiums are like your monthly subscription fee for health insurance. It's that monthly cost. They vary depending on the plan's meta level, like we talked about before. And depending on the meta level, will indicate the amount of the premium. So what's changed this year, remember, is that where silver premiums always used to be lower than gold premiums, this year gold premiums are actually lower than silver. So that's a big one to keep an eye out for. The next one is deductibles. So deductibles are the amount you pay for covered, excuse me, covered healthcare services before the insurance plan starts to kick in and cover costs. Um, Oftentimes, the higher tier plans have lower deductibles, meaning you pay less out of pocket before your insurance company begins to cover the expenses. One more is copayments. So copayments are those fixed amounts you pay for services, such as a doctor's visit or a prescription after you've met your deductible. So like for me, it's $25 each time I go to see the primary care provider. Different plans have different copays, and that's something you should look into and find one that you're comfortable with. And we'll go into how you can learn all that detailed information later. And then finally, another big one is the maximum out-of-pocket cost. So this is the most you could pay in out-of-pocket costs, so that's separate from your premium, in a health insurance plan year. And the health insurance plan year almost always goes from the first of the year to the last of the year. So the federal government sets a maximum limit that you can pay every year, that you'd have to pay every year, and your health plan can kind of choose whether that limit is lower than that. So you should check your plan documents, which we can show you when we go into the details in a little bit, how to find that number.
And can you explain how I would look at plans and understand how much they'd cost?
Sure. So the best tool we have out there is on our website, and it's called the Plan Comparison Tool. I'm going to show you right now on the screen, you're seeing the side toolbar on our Vermont Health Connect landing page info site. And if you just search for Vermont Health Connect, you should, you should wind up getting to this site. And there's an option that says compare plans, and you can see the plan comparison tool is the first item on that list. That is by far, I think, our best resource for people to shop around. Before we go into the depth of the plan comparison tool, I do want to show you another option if you want to kind of dive into some of the details on your own without the use of the tool. You can select qualified health plans, which is what we're talking about here today. And you can go click that. By clicking qualified health plans, you see this list of various things like plan comparison brochures, summary of benefits and coverage, etc. And that shows you details for all the plans that are offered. So you can really kind of dive deep into the details of your plans by clicking through those links. But again, the plan comparison tool really does a lot of this for you without having to navigate as much to the website. So going back to the plan comparison tool, if you click there, and there are a few different ways to get there. We've linked it in different parts of our website. But if you go to the plan comparison tool, you see the shopping cart. There's also a video you can see below that's kind of a user guide that shows you how to use the plan comparison tool. But by clicking that shopping cart, you're brought to this screen here. And on this screen, it's pretty straightforward. It tells you what you're going to expect by completing the plan comparison, by using the plan comparison tool. You start by entering your zip code. The next thing you'd have to enter is just some basic demographic information. So you can enter your age. You can choose whether or not you want to rate your health or expected procedures, and you don't have to. And then you can see there's a list of options that may direct you towards certain outputs. You don't have to select anything except your age. Your age is important because that is an eligibility factor for what type of insurance you can get. The other thing I want to point out is it's very easy to add other people in your household. you want to add all the people in your household. So we're going to be talking about an example of a family of four. So in the family of four, I didn't do it in this slide here, but you can see the add spouse button on the top right. So what I did is I started with myself, I added a spouse, and then I added two dependent children. And for easy figuring, we both of the adults were age 50, the kids were 15 and 10. And then I click next step. And there's a couple more screens that are just kind of providing you with some information, but then you go to kind of see the plans. And what you see first is this is a screenshot of what the output is when you go through the tool and you get the results. So you can see there's a lot of information on this slide, and it's a little bit small, but I'm going to walk you through some of the details. This is going to tell you based on how much you're eligible for tax credits, how those apply to each one of the plans that we offered. So each of the 22 plans. So you can scroll through these. And what's really important that we're going to spend a little bit of time now on is talking about how to sort and filter these plans. So you can see that, oops, you can see that on the top of the screen, we're looking now, this is the same shot as the first as the left, it's just blown up on the right. And you can see that it shows uh, who is in my household. So you've got the two 50-year-olds, the 15 and the 10-year-old. And by the way, it also had asked me what our household income was, and I entered $100,000 for that family. So we're talking about a family of four here with an income of $100,000, household income of $100,000. So the first plan that comes up is a bronze plan, and you can see this one is from MVP, and there's a few things that it's already filtering by. So it's starting with the balanced cost estimates. And you can play around with good year cost estimates, balanced cost estimates, or bad year cost estimates. And that will kind of tell you if you expect to have a bad healthcare year would mean that you need to use your healthcare a lot. A good healthcare year would mean you wouldn't need to use it as much. Because the amount you pay will differ slightly depending on how you need to use the plan. So this right now is just looking at all of our plans, but filtering by balanced cost estimates or sorting by balanced cost estimates. You can also sort by, if you see on the right, kind of hamburger type looking filter button in the top right of this screenshot, you can see that you can also filter by premium, by plan A to Z alphabetical, or by quality rating. So there's a lot of ways you can filter these plans or sort these plans, I should say. On the left navigation of this screen, you can see the filters. And we can filter any which way we'd like. We can filter by the meta level that we choose that we'd like to look at, knowing what we know about the amount that the insurance company pays versus the amount that I have to pay might indicate which meta level I want to look at. You can look at the plan type, whether it's an HMO or an EPO. You can look at plan features like whether it's HSA eligible or it's a national network. And you can sort by our two insurance companies offered on the exchange. The other thing that you can sort by or filter by is the premium amount. So that's that monthly cost. So you can see the most that in this scenario I would have to pay is $1,100 a month. The least is 23 cents. So I can find what I'm comfortable paying with. I can say, I'm not comfortable paying more than $400 a month. So I can toggle that slider down to $400 and it'll only come up with plans that are $400 or less. Same with the out-of-pocket limit, that's that maximum out-of-pocket. I can toggle that up and down to determine what I'm comfortable with spending out of pocket at a maximum level over the year. I have a couple examples here that I want to show you where we dive a little bit more in detail about how the subsidies work. So this is a bronze plan example. So again, this is being sorted by the balanced cost estimates. And it's important to remember, this is just because it's sorted by balanced cost estimates. Depending on how you filter and sort will depend on what the top result on the tool. So right here, we're just sorting by balanced plan results. And you can see that the MVP Vermont HDHP Bronze 3 plan, you can see on the right that it's the monthly premium is 23 cents, and that is correct. That is correct. Like it is 23 cents a month that you would have to pay for this plan. Now, this is a higher deductible because it's $9,200 deductible. That's also the maximum out-of-pocket limit. You can see that it's HSA eligible, and you can see that it is part of a national network. And you can click on most of these things to get more information. If you click on the button in the top right that says View Plan Details, you can dive into a lot of the details that we saw in these other parts of the website, like the cost for different services, etc. And then under annual cost estimates, remember we were sorting by balanced. We could sort by good or bad year, but we can also just see that for these plans, a good year, the annual cost estimate would be $900. So that would mean using your plan very infrequently, or maybe not infrequently, but having relatively low healthcare need. A bad year would be utilizing it significantly, and that cost would be significantly larger. So you can see how the math is calculated. This plan, if we go with the Vermont MVP Vermont HDHP Bronze 3, is actually the total cost of that plan before any financial help is $3,044.23. This family of four is eligible for $3,044 financial help a month. So that is how that is getting down to 23 cents a month. So you can see similarly with the Vermont, the Blue Cross bronze, CDHP plan. That plan is 2 cents more. They get the same amount of financial help because that doesn't change depending on the plan. And that would cost them 25 cents a month. And they might have a preference over which one they choose once they dive into the plan details, etc. Now let's look at a gold plan. The numbers are a little bit different here, except it's the same family of four with the same household income. Now you can see the monthly premium for the MVP plan, the gold one. This is again sorted by balanced cost estimate, is $174.50 a month. That's still after that $3,044 subsidy. So the total cost of this plan is $3,218.50 a month, minus the tax credits of $3,044 equals the plan price of $174.50 a month. So that's how much you're planning. And I say tax credits, $3,044. There may be some other small percentage that is state-based financial help, but the majority of this is advanced premium tax credits from the federal government. You can see if you choose the Vermont VT Plus HDHP Gold 3 plan, that plan cost is a little bit more expensive, $3,356.53. You still subtract the same amount of subsidies, and you end up with a more expensive monthly premium of $312.53. Now, take a look at the annual deductibles for these plans. These are significantly lower than they were for the bronze plans, as we discussed in prior slides. The out-of-pocket limits are also lower. The Goodyear prices, the Goodyear cost estimates are higher because you are paying more guaranteed monthly to your premium. So that was a lot of information, but hopefully that gives a general good example of how you can start to dive into plan selection.
That's awesome, Zach. Thank you for that overview and all the details there. It's really exciting to see how many cost-saving options are available for Vermonters this year. So when do I have to do this? What are some of the important dates?
Yeah, so as I mentioned at the outset, open enrollment goes till January 15th that you can see here, but December 15th is really the date that we want to kind of hone in on because you need to enroll by December 15th if you want a plan that starts by January 1st or I should say starts January 1st. So if you can still enroll after December 15th, but your plan will not start until February 1st. So do as much of your shopping and plan comparison as you can now and enroll now well before the December 15th deadline, so that you can get that plan starting on January 1st. January 1st is when those plans start. So your coverage will be assuming that you enroll and all necessary payments have been made, etc. Your plan will start January 1st. The last day of open enrollment that you can apply for a plan in 2024 is January 15th. Again, if you're applying after December 15th until January 15th, your plan will not, you can still enroll, but your plan will not start until February 1st.
That's great to know. Thank you, Zach. So how do I enroll?
So there's a few different ways to enroll. Online is one of the easiest ways to apply. We have our online application. You can just log on to our website. We have a secure portal there. And then we've got our paper application. And we've also got our call center. So the paper application, you can always call us to request it, but it's also downloadable from the website. You can call us at 855-899-8600. That should be 9600. That's a typo. So it is, again, just to correct that, that is 855-899-9600. Or you can meet with a in-person assister, which is people in the community who are all over the state, generally situated in community-based organizations or providers' offices, hospitals, who are trained to sit down with people either in person or virtually and walk them through the application process. They can even, with your permission, apply on your behalf and help you maintain your coverage. A few other things that we just encourage people to do are we have online resources. If you go to our website under Learn More, you can watch some videos, you can read more about different terms. There's really a lot of information available there. We also are on social media on Twitter or X, YouTube, and Facebook. And we put out posts almost daily during open enrollment that range from important dates to enrollment tips. Some videos are up there that really try and clear up what can be really complicated for folks. So we encourage you to check those out as well.
And Zach, just to follow up on that, I believe this recording will also be posted on our website very shortly. So this is also a reference for anyone who might want to come back and check out what we've talked about.
Absolutely, yeah. And our, we are here to help people answer these questions. This is complicated stuff and things are always changing. So please contact us if you have questions. Um, just to kind of summarize, open enrollment goes until January 15th. We're live now. There's a lot more financial help available this year. Really shop. We want you to shop this year. There's a lot of changes, especially those, excuse me, changes to the gold plans and silver plans. So even if you thought, first of all, you couldn't get help before, check again because you might be able to get financial help now. Um, and second is even if you could get help before, see if the plan you're in is still the best one for you, because there might be a different plan that you hadn't considered before, and because of the calculations, things may have changed. It's really important that you shop and see what plan is best for you. Again, get in touch with us at 855-899-9600. Work with an assister, go online. We're here to help. So I think that kind of summarizes, Alex, what we were going to talk about. We have time for some questions, hopefully.
Yeah, I think we do. And thank you so much, Zach, for going through all of that. I hope it was helpful for folks to be able to see and hear and go through the process with us. We do have some questions, so I'm gonna go ahead and start bringing these up so we can answer them for you. Firstly, I'll say there's one from the chat asking if these sessions are recorded and available later. Yes, they will be. And there is another session happening on December 3rd. That one is going to be in the evening. So if you have anybody in your friends and family that might want to get more information, they can look at this recording afterwards or join us for the meeting on December 3rd. So I'll start up with a question from the group for you, Zach. Which is better if you need to access healthcare out of state, MVP or Blue Cross Blue Shield?
That's a great question. We get that question a lot. That's something that, we can't really answer. We are the facilitator of this, but you should definitely contact the both companies and talk to them about what their coverage network is like. It's a great question. Unfortunately, we can't really provide a, a definitive answer.
Thank you, Zach. And the carriers, I'm sure, would be happy to provide more information about how their plans would work for you and your health coverage needs. So here's another one we have. How do you estimate income for 2025 when you contribute to an HSA? Do you just subtract it when entering into cost calculator? And how does IRA withdrawals work in this if you're not sure of the amount being withdrawn?
That's that's a that's another that's another really good question. I'm a little bit hesitant to dive into the depths of that and suggest because it's um, you know, because it's income dependent and we would really want you to kind of talk about the specifics of what your situation is and what you're looking at with an eligibility specialist. So on that one, I would suggest uh, calling in and talking to uh our customer support staff.
Absolutely. We have a dedicated eligibility and enrollment unit at DIVA that is always happy to help with questions like this if you want to get in contact with us. Let's see. The next one I've got here is, hold on one moment. We've got a comment from someone that they're dumbfounded that the rates are so much lower for 2025. Is there a chance that rates will go up during 2025 outside of the open enrollment period?
That's a great question. Yeah. They are lower. I mean, some of them are lower. I think it depends on your situation, right? So the rates themselves may not be that much lower in all cases, but depending on the subsidy eligibility, you may see that your individual rate is lower. The rates are set for the plan year. So during the plan year of 2025, those rates should not go up. Those are set for the calendar year. Um, That being said, every new year is a new conversation, new negotiation. Um, so you can be confident that the rates that are set for 2025 that you're seeing in the plan comparison tool, et cetera, are what will stay for the whole year of 2025.
Thank you, Zach. And I've got one here if you're able to answer it. What is the difference between an HMO and an EPO?
Yeah, I think the definitions, I don't want to misquote, but let's get one of our team members to get the exact definition of the difference between those so that they know that I'm not kind of misspeaking.
Okay, we can come back to that one for us then in a moment. Um, let's see. We've got one here. In determining household income, we have a non-dependent daughter who is 25, turns 26 in May, who we may include for coverage. Since she is non-dependent and living out of state, is her income counted? Also, can she stay until December 31st of 2025?
Um, that's that's one that you definitely want to talk to an eligibility specialist on. Without, and I appreciate you kind of trying to summarize without kind of asking more follow-up questions. We wouldn't be able to give you a definitive answer, but I think that our eligibility specialists would be able to. So please call and talk to us.
And I think that can go for pretty much anything as well. If you run into issues or if you have questions, please feel free to get in contact with the department, get in contact with an assister. Someone will be able to answer your question and help you navigate through the process. And I think we may have an answer on the previous question of EPO and HMO plans. I'll let you go through that, Zach.
Yeah, so and this is kind of it's consistent with how you might understand an HMO in outside of Vermont Health Connect, but it's HMO plans, health maintenance organization, in other words, are plans that may require approval of services by your primary care. So generally, there's a more kind of definitive network where you would be more inclined to seek services in. Um, and um, versus the EPO would be more individual.
And I think again, that was probably an area where the carriers, the insurance companies might have a better definition for you than we have. But thank you, Zach, for providing that. I think I just saw one come in a moment ago. What happens if my income changes during the year?
Oh yeah, that's a great, really important question. You need to report any changes in address, contact information, and definitely income, household size. All those things should be reported to us. Income and household size are big ones. Please call us as soon as you have that change, because especially if you're receiving subsidies, that will impact the amount that you could get, depending on it going up or down, could mean that you're eligible for more or less financial help. And because this is a tax credit, I'm not going to get into the details of how that all gets reconciled, but it will be much easier to have that reported. And I think you're required to, but you really don't want to get into a situation where you've been receiving a certain amount of financial assistance based on an incorrect income, because that can just make things really complicated and put you at some kind of financial risk. So please, income changes, you can always call us.
Absolutely, absolutely. Kind of going off of that, we had a question that just came in. Are the tax credits figured in all along, or do we get a tax credit when we file in April?
Great question. You can do either. You can, and actually something in between. So you can, um, depending on your income information, you can select to have the tax credits applied to your premium bill. So, excuse me, that's why they're called advanced premium tax credits, meaning they don't necessarily come to you um, when you reconcile your taxes in April, but instead could come in advance. Um, You can also choose not to receive any tax credits and then reconcile your taxes in April and get a significant, hopefully, tax credit at that point in time. Couple things to mention on that is that, like we said before, changes in income are really important to report so that your tax credits reflect accordingly. The other thing is you have to enroll through Vermont Health Connect to be eligible for tax credits. You cannot go directly to the carrier or anyone else to get those tax credits. Vermont has a state-based marketplace, so if you want this financial help, you have to come through Vermont Health Connect. Even though your plan is through MVP or Blue Cross, you need to enroll through Vermont Health Connect to get the financial help.
Thank you, Zach. All right, so we've got time for a few more here. So, do dependent children's income living at home need to be entered into the household income totals, driving up the reported income, or only the parent's income?
I think that that's probably an eligibility question that I don't want to answer directly here, but I think depending on the situation, um, probably it would be advised to talk to an eligibility specialist on that one.
Absolutely. We have, dedicated teams who are here to help support you and navigate through this process. So absolutely, please feel free to
And,
give us a call and we can talk about that.
and Alex, I do want to mention one other thing too, is that I'm saying call, but we actually have some other, obviously you can work with an assister, but also we have a secure message portal. So if you log into your account, you don't have to call. You can log into your online account through portal, um, and uh, you can submit a secure message to our team who will answer questions about your account to you. So, specific questions like that one. But in general, I mean, you should report income to Vermont Health Connect as it's reported on your taxes. But I think that we don't want there to be any kind of misunderstanding on this one.
Absolutely. Absolutely. I also want to note we have had a couple questions come through that are about very unique individual circumstances. And in those cases, we'd encourage you to get in contact with us or get in contact with us through the website as Zach just went through. Um, Here's another one. The plan comparison tool has us enter our zip codes. Are there different plans available based on location?
No, uh, all plans are available to the entire state.
Thank you. Um, all right, I've got another one here. Let's see. I am trying to re-enroll. I received income from a job up until the end of October, and I applied for unemployment insurance at the beginning of this month. How does this affect the re-enrollment process? Do I need to call to make this change?
Can you say that one more time, Alex? Sorry, I'm not seeing it in front of me, so I just wanted to hear it one more time.
All right, yeah, I am trying, it's just the top of the published column. I am trying to re-enroll. I received income from a job up until the end of October, and I applied for unemployment insurance at the beginning of this month. How does this affect the re-enrollment process, and do I need to call to make this change?
Um, so I think that you should report any of the changes to us for sure. I think that that you should definitely, I think that your change in income, and the unemployment income should be reported. Um, I can't say specifically, but that shouldn't kind of be a barrier to enrollment. Your new eligibility will be determined based on those changes that you make. So you may have been eligible for something different before, and now you're eligible for something slightly new or different now that you no longer have the job.
Thank you, Zach. Um, we have a few more minutes. I'm not sure I see any additional questions in the queue, but I'll give it a moment in case folks have additional things they want to hear from us on.
These are all great questions.
Yes, thank you all for these questions. These are really good for us to hear from you, and glad that we have a chance to talk about them. So we've got another one here. Can you speak to the Inflation Act and how much it impacts and how long that it affects maximum income levels for dependent children up to 19 who qualify for Medicaid? Or do all children qualify for Medicaid if they are uninsured, no matter the income level reported by the household?
Um, so let me break this down into a couple pieces. So the Inflation Reduction Act changed financial help available to the end of 2025. So we know that financial help available for qualified health plans is available through 2025, and it did make it so that higher income levels could receive help when they wouldn't have before. So how long that affects so then there's a question, do all children qualify for Medicaid if they're uninsured? No, it depends on their income by the household. So in part, that is one of the eligibility factors. So children are not automatically eligible for Medicaid. There is income is one of the eligibility factors for Medicaid.
And I
So
think this is
hopefully I answered that question.
I think you did, Zach. And I think it's also important to note that in the case that one is not eligible for Medicaid, that is a great opportunity to take advantage of the subsidies on Vermont Health Connect, because that
Absolutely.
is
Yep.
very much meant as an ability for folks who may be transitioning off of Medicaid to receive considerable financial assistance.
Yeah.
Um,
And I'll just add to that, Alex, that it is absolutely possible for a family to have, for example, parents or caregivers who are uh, not eligible for Medicaid, but children who are, because the income thresholds are different for adults than they are for children. So we may see that uh, parents are eligible for a qualified health plan with financial help, and the children are eligible for Medicaid.
right. Right. And of course, we also refer to Medicaid for children in Vermont as Dr. Dinosaur. So you may see that term thrown around as well. That's the same thing as Medicaid. Um, got another question here. I'm interested in finding an assister to talk about all this with. How do I know where they're located?
Great. To our website, uh, you can, there is a tab that says Get Local Help or Find Local Help. And when you go to that tab, it'll tell you about the Assister program and you can search for a directory. Many organizations that you're probably familiar with are enrolled in the assister, have assisters at their organization. So it's really best to start where you're already a customer. It's easier to get in and generally a much smoother process. If you have any trouble finding an assister um, through our website, you can always call our customer support line who can help you, or you can email us at our Vermont Health Connect general inbox, and we can help you navigate that.
Thank you, Zach. I've got another here. Do the gold plans that silver people are being switched to still include vision and or dental coverage?
So at a high level, what I'll say is that the gold plans, if people were moved automatically to a gold plan, uh, they were moved to a plan that has the most similar coverage benefits that their silver plan had. There could be slight differences, and it would be important to make sure that the covered services are what you expect. So I don't want to go into the details of that. But you can look at the website plans details or call the carriers to be sure.
Thank you, Zach. So I'm gonna give it a moment. I don't see any additional questions coming through. So I'll give it a moment and see if we have additional inquiries from the audience. I want to take this opportunity again to thank everybody for being here and learning more about Vermont Health Connect and coverage and open enrollment for 2025. As always, you can get in contact with the department through our website or through our phone number or through contacting the assister program. And we are always here to help navigate the open enrollment process.
Yeah, thanks, Alex. I did have one other thing I wanted to mention about that last question. So for those customers who were automatically moved to a gold plan from the silver plan, um, you, if that's you, you are not required to stay in that plan. That's just where you were automatically moved to because those silver plans went away. If you would like to choose a different plan during open enrollment, you absolutely can. And the deadlines for that would be the same as the general open enrollment deadline. So do that before December 15th if you want to get that starting um, on January 1st. But you can do that. So don't feel like you are required to be in that plan as your only option. You still have access to the rest of the plans available.
Thank you, Zach. That's important to note. And we do have a follow-up question about the Inflation Recovery Act. How much are maximum income levels raised through 2025 to qualify for Medicaid, or is it only for the QHP subsidy eligibility maximums? And that is, I believe, only for the QHP plans.
Yeah, and we have all the tables available. The Medicaid income thresholds, and this is getting a little bit into the details, but those do change, but those were not that the Inflation Recovery Act didn't affect that specifically. Those go up generally annually, or those change annually, I should say, but the maximum income levels is really related just to the QHP subsidies.
Well, again, we got about 5 minutes left in our allotted time. I really want to thank everybody for spending your lunch hour with us and for such a robust and productive conversation. I hope this has been helpful for anyone who's looking at Vermont Health Connect and this open enrollment period. I hope we're able to create some cost saving opportunities for all Vermonters in the coming year. And we're glad that we were able to provide this information for everyone. And as always, again, please feel free to reach out with any additional questions or if you'd like some additional assistance navigating the process.
Thanks, Alex. Yeah, well said. And please shop and ask us if you need any help. Happy open enrollment.
It's the most wonderful time of the year. So I don't see any additional questions coming through. So I think we can probably bring this meeting to a close. And I really appreciate everyone's time and energy. And thank you, Zach, for being our expert today. Again, my name is Alex McCracken with the Department of Vermont Health Access, and it's been a pleasure, everyone. Thank you.
Take care. Bye-bye.